Foundations of ethical practice in nursing. Understanding ethics in nursing. Ethical practice in nursing involves making decisions that align with professional standards, laws, and moral principles to ensure patient safety and dignity. Definition: making decisions that align with professional standards, laws, and moral principles. Purpose: protects patient rights and autonomy while building trust in nurse-patient relationships. Benefits: helps resolve difficult moral dilemmas and ensures compliance with professional standards. Foundation: based on established ethical principles and professional codes of conduct. 6 ethical principles in nursing. These fundamental principles guide ethical decision-making in all nursing practice situations and patient interactions. Autonomy: respecting patients' rights to make their own healthcare decisions. Supporting informed choice even when disagreeing with patient decisions. Honoring cultural and personal values in decision-making. Beneficence and non-maleficence: acting in the patient's best interest while avoiding harm. Promoting well-being and preventing injury through careful practice. Balancing benefits and risks in treatment decisions. Justice and fidelity: ensuring fairness in patient care and resource allocation. Keeping promises and maintaining trust with patients and families. Providing equal care regardless of personal characteristics. Veracity: being honest and truthful in all communications. Providing accurate information to patients and families. Maintaining transparency in professional relationships. ANA Code of Ethics for Nurses. The American Nurses Association Code of Ethics provides essential guidelines for ethical nursing practice and professional behavior. Key provisions for LPNs. Respect for human dignity and individual worth. Commitment to patient advocacy and rights protection. Accountability for nursing actions and professional decisions. Collaboration with healthcare teams for optimal patient outcomes. Upholding patient confidentiality and privacy rights. Maintaining professional competence through continuing education. Common ethical dilemmas. Nurses frequently encounter challenging ethical situations that require careful consideration and appropriate responses. End-of-life decision dilemmas. Do not resuscitate, DNR, orders and family disagreements. Withholding or withdrawing life support measures. Balancing patient wishes with family expectations. Informed consent challenges. Patients refusing necessary treatments. Family members attempting to override patient decisions. Cultural conflicts regarding medical decision-making. Confidentiality and privacy issues. Handling sensitive patient information appropriately. Managing HIPAA compliance in complex situations. Balancing disclosure needs with privacy rights. Resource allocation decisions. Determining who receives limited treatments or resources. Managing competing patient needs with finite resources. Addressing conflicts between individual and population needs. Ethical decision-making process. A systematic approach helps nurses navigate complex ethical dilemmas and make appropriate professional decisions. Systematic decision-making steps. Identify the ethical issue, clearly define the problem and stakeholders involved. Gather comprehensive information, review medical records, patient wishes, and legal guidelines. Consider ethical principles, apply autonomy, beneficence, justice, and other relevant principles. Explore options and consequences, evaluate possible actions and their potential outcomes. Make decision and take action, choose the most ethical course based on analysis. Evaluate the outcome, assess whether the decision was appropriate and effective. The nurse's role in ethical decisions. Licensed practical nurses play important roles in supporting ethical decision-making processes and patient advocacy. Primary responsibilities. Provide accurate, unbiased information to patients and families. Advocate for patient rights and best interests consistently. Consult supervisors or ethics committees when facing complex dilemmas. Document all ethical concerns and decisions accurately. Recognize personal biases and avoid inappropriate influence on patient choices. Support patients through difficult decision-making processes. Patient autonomy and informed consent. Patient autonomy represents a fundamental ethical principle that guides nursing practice and patient interactions. Understanding patient autonomy. The right of patients to make their own healthcare decisions. Includes the right to accept or refuse any treatment. Must be supported even when nurses disagree with choices. Informed consent elements. Patients must receive all relevant information about treatments. They must understand risks, benefits, and available alternatives. Consent must be voluntary without coercion or undue pressure. Patients must be mentally competent to make decisions. Nursing role in consent. Ensure patients understand their choices and options. Advocate for patient rights if consent is being pressured. Recognize when patients lack capacity for decision-making. Confidentiality ethical considerations. Maintaining patient confidentiality involves important ethical principles that guide nursing practice and information sharing. HIPAA and ethical practice. Protects patient information from unauthorized disclosure. Supports trust in healthcare relationships. Balances individual privacy with public health needs. Confidentiality exceptions. Reporting suspected abuse, neglect, or life-threatening situations. Public health emergencies requiring disease notification. Legal requirements such as court orders. Patient safety situations requiring team communication. Ethical guidelines. Share information only when necessary for patient care. Maintain discretion in all professional conversations. Respect patient wishes regarding information sharing. Professional boundaries and ethics. Maintaining appropriate professional boundaries protects both patients and nurses while ensuring ethical practice standards. Unethical boundary violations. Accepting expensive gifts from patients or families. Developing inappropriate personal relationships with patients. Sharing personal opinions that could influence patient decisions. Using patient information for personal benefit or gain. Ethical professional behavior. Maintain professional distance while demonstrating empathy. Uphold confidentiality in all settings and situations. Refer ethical concerns to supervisors or ethics committees. Focus on patient needs rather than personal interests. Managing moral distress. Moral distress occurs when nurses feel forced to act against personal or professional values, requiring effective coping strategies. Causes of moral distress. Witnessing poor patient care without ability to intervene. Being required to follow policies that conflict with ethical principles. Feeling powerless to advocate effectively for patients. Experiencing conflict between institutional and professional values. Coping strategies. Seek support from supervisors, ethics committees, or trusted colleagues. Participate in ethics education and professional development activities. Engage in self-care practices to prevent burnout and maintain resilience. Use institutional resources such as employee assistance programs. Summary and professional commitment. Ethical practice ensures patient rights, safety, and dignity through application of fundamental principles including autonomy, beneficence, and justice. Nurses must balance these principles when facing common ethical dilemmas involving consent, confidentiality, end-of-life care, and professional boundaries. Using systematic decision-making models helps resolve ethical conflicts while seeking guidance from supervisors and ethics committees provides additional support. Key takeaways for practice. Ethical principles guide all nursing decisions and actions. Patient autonomy must be respected even when disagreeing with choices. Professional boundaries protect both patients and nurses. Seeking guidance demonstrates professional responsibility and integrity. Thank you for learning about ethical practice in nursing. Your commitment to ethical principles ensures that patients receive respectful, dignified care while maintaining professional integrity.